The teen sleep and social media crisis is hitting a breaking point in schools, and new state mandates like Georgia's HB 268 are now requiring districts to provide formalized mental health and suicide prevention supports by July 2026. Meeting these requirements doesn't have to mean a massive budget increase. You can build a 3-tier sleep and digital wellness protocol immediately using the staff you already have. To get started, you only need 3 things: your master bell schedule, the back-to-school communication packet, and the nurse's daily visit logs. Utilizing these existing administrative resources is the most sustainable way to combat digital fatigue while staying ahead of legislative deadlines. Step 1 begins with parent communication. We need to move away from vague warnings and toward data-backed boundaries. Standard limit screen time messages often fail because they don't explain the biological stakes to the family. This comparison shows the difference. 4 or more hours of nightly scrolling rewires a child's natural wind-down sequence. Integrate this biological data directly into a back-to-school handout, paired with counselor scripts for when sleep issues are flagged. Providing parents with hard evidence transforms a household argument into a critical health boundary. Step 2 addresses the school day by building a mandatory 15-minute phone-free quiet time into the schedule. On the master schedule, this is a simple mechanical change. Carve out a block immediately after lunch or within an advisory period. During this window, school policy must require strict physical phone storage. The devices are put away entirely for the duration of the reset. Framing this block as nervous system regulation shifts the dynamic from a disciplinary battle over phones to a shared physiological goal for students and staff. Enforcing this midday pause creates the right conditions for improved afternoon attention and behavior across the entire semester. Step 3 is the most critical, establishing a clear clinical referral pathway to catch students before they reach a crisis point. This flowchart triggers when a student visits the nurse for headaches or fatigue 3 times in a week. This clinical signal prompts a professional assessment. Standardized referral language makes it easy for parents to transition them to teletherapy. This triage step fulfills the mental health support requirements of HB 268 by ensuring every flagged student has a pathway to a licensed clinician. A clinical partner like MentalSpace School integrates with your team to provide this layer, offering same-day assessments that are $0 with Medicaid and in-network with most major insurance providers. Without this formalized triage, schools often waste resources on disciplinary measures for what are actually underlying sleep and mental health deficits. When you combine the parent packet, the 15-minute reset block, and the clinical triage pathway, the school environment changes. In districts that have partnered with MentalSpace to implement this protocol, the outcomes are concrete: 89% improved attendance, a 92% reduction in student anxiety, and 85% family satisfaction. This clinical layer provides the professional support necessary to meet HB 268 compliance, while offloading the diagnostic burden from school staff. Districts can activate this missing clinical layer today by integrating with the MentalSpace School framework. Sustainable digital wellness isn't achieved through one-off lectures, but through structured regulation and immediate access to clinical care.